Hi guys, long time no talk. Abnormally Abby, weight loss surgery. So it's been like 6 weeks since I made a video, and I'm sorry, but I've had so much stuff go on in my life in the last 6 weeks. First, let's get to this. I am finally down under 300. I know I mentioned that in my last video. Right now, as of today, I am 273, so that's awesome. My lowest adult weight was 260, and I had actually been 5 months pregnant at my lowest adult weight. So I have 13 more pounds, and I get to my one goal I want to surpass, and I'll be the lowest I've ever been as an adult, so I'm excited about that. Also, about 4 weeks ago, I had severe upper abdominal pain, and I didn't know what was going on, and I thought that it might be an ulcer or something wrong with my pouch. So I was really scared. I went to the emergency room. My boyfriend talked me into it because I couldn't stand the pain. I was in tears, and he brought me to the emergency room and took days off of work and all that good stuff because he's an amazing boyfriend. And yes, we're still together, and yes, it's still amazing, and yeah, all that good shit. But anyway, so I was in such bad pain, he took me to the emergency room where I had my surgery, which is Albany Medical Center in upstate New York. And we go there, and I had to wait in the ER, or like outside the ER, for 2.5 hours before they even called me into the ER. Then we were there for a total of about 7 hours, and they didn't do anything. They did no tests. They did take some blood and urine specimen, and they told me I was dehydrated and my white blood cell count was elevated, but they weren't going to run any other tests because they were very busy with traumas that night. So I ended up being put in a hallway for overflow and doing IV fluids. 1 bag of IV fluids, and then they let me go. By the time I got home, it was 4 o'clock in the morning. The next day, the pain was worse than, that day. I was in tears. It was continually sharp pains in my upper abdominal by my chest, right under my breastbone. So I ended up going to a different ER that's in Albany. And I was like, I'm a bariatric patient. Something is wrong. The first doctor that came in and saw me was like, do you still have your gallbladder? I was like, yeah, I do. And they never put me on Actigol because someone messed up after my surgery and I never got the prescription for it. And he's like, it's your gallbladder probably. Let me run a test really quick. He did an ultrasound, and within an hour we knew it was my gallbladder. They gave me pain medicine and told me that I need to have it removed. But their surgeons can't touch me because I'm a bariatric patient, and they don't deal with bariatric patients at that hospital. So he called my surgeon at another hospital that did my gastric bypass, and he was booked up for 3 weeks, and there was no other surgeon that could do it, so I had to wait 3 weeks. They did give me pain meds in the meantime, which didn't help that well, and I don't like to take prescription painkillers because I do have an addictive past. But anyways, I did take them because I was in so much pain. So I went to see my surgeon. He said, yep, we have the scans, you have gallstones, and you need to have your gallbladder out. Scheduled the surgery for 2 weeks later, and I had my surgery. It's been 2 weeks now since the surgery. And they did it in 1 incision instead of laparoscopically. Like multiple. They just did 1. They cut a circle around my belly button and took it out that way. I was in tremendous amount of pain afterwards. I have a very high pain tolerance. I don't deal with surgery well in my stomach area. The muscle thing just hurts, and I'm still bigger than a lot of people, and when you're bigger, I'm not gonna lie, surgery just hurts. So it took me, my boyfriend took care of me for 3 days afterwards. No lifting, I had to keep the incision dry, and I have a problem with getting infections after surgery. So I had gauze pads and all that nice stuff. It was gross, and my boyfriend couldn't deal with the blood. They sent me home. They didn't keep me. It was outpatient surgery. They sent me home with a fever of 101 point something. And also, I was bleeding. They wrapped my incision, packed it, and put clear tape over it. I went right from the hospital to Walmart to get my painkillers filled. And I was at Walmart. It took the pharmacy 90 fucking minutes to fill my prescription for my painkillers. In that 90 minutes, I bled through the gauze that they had packed it with, my underwear, my pants, and my shirt that I pulled over my pants. And my boyfriend's like, honey, you're bleeding. And it was just horrible. I was in a horrible amount of pain. I went home and changed and cleaned up, and my grandmother actually helped me because he can't deal with blood. Silly man. But I'm 2 weeks out from that surgery. I am doing good, exercising again. I can't lift anything over 10 pounds for 4 more weeks, 6 weeks in total. But I'm back to doing cardio. You know, I've lost a good amount of weight since my gallbladder surgery, which I'm sure having my gallbladder out helped a little. My parents said I was cheating because I had body parts removed. But, yeah. I've also gotten a lot of new followers on my Instagram and my Tumblr, and people adding me on Facebook, and I am so happy that I can inspire all of you guys. And I know that there were so many people on YouTube and Tumblr and blogs that I really looked up to before I started my journey and in the beginning. So if you guys ever have any questions, you know how to reach me. My Tumblr is remodelmymind.tumblr.com. My Facebook is www.facebook.com/abnormallyabby. My email address is abnormallyabbyweightlosssurgery@aol.com. My Instagram is abnormallyabby. It's private, just add me and I will add you back. Twitter is abnormallyabby. And Snapchat is abnormalabby if you ever want to send me snaps. I'm an open book. You guys can leave me questions, email me, ask me anything you need. Also, you guys can reply in the comment section down on YouTube. I'm always here, you know, just working it out, living the good life, fighting the good fight. Another thing I want to touch on is a couple personal things that I've been dealing with. As a profession, I work from home. And I work for a couple nightclubs doing advertising and promoting, and I've done that for 5 years. I also have this position now that I work at home because I'm a caretaker for both of my grandparents. My grandmother helped raise me, and she's the closest thing to me, and I'm sure I talked about her in other videos, my Pookie, I call her. I have my tattoo for her and all that. I love her to death. My grandmother's 82. She just turned 82 on August 4th. My grandfather's 80. I live in an in-law apartment with them, and I'm their full-time caretaker because they refuse to get a nurse. This past week has not been a good one. They were both admitted in the hospital. My grandmother was admitted on last Monday night. My grandfather was admitted on Wednesday night. My grandmother had severe bleeding from her rectum, and they thought it was cancer, colorectal cancer. They did tests, and she does have a node, whatever they call it, on her liver and kidneys, but they did a biopsy, and it's not cancerous, and they took her off NSAIDs, because, as you know, NSAIDs upset your stomach, and although she's not a bariatric patient, and she's older, she's been on them for so long that it caused, stomach bleeding, and it was coming out, So, she lost a lot of blood. She had to get blood while she was in the hospital. She was very weak. She stayed in the hospital for 7 days, and she was released this Sunday. And she's home, and she's doing all right. My grandfather had an intestinal blockage, and he also had to get blood in an NG tube to pump his stomach. That's something he's battled with for the last 10 years because he has scleroderma, which is a form of lupus. We have a lot of health problems in our family, and that's why I decided to take care of my health while I was still young and don't have to deal with it when I get older as much. But it was very hard on me. My grandparents are both very old, and my grandma is the closest thing to me, and I was very scared, and they asked for a lot of prayers. If you saw my Facebook, that's what that was about, and why I hadn't blogged so much for the last week. But they're both on the mend. They're both home from the hospital, and, you know, it's very hard on me to be a primary caretaker. Mentally, it takes a big toll on you to see someone decline right in front of you. My grandmother really can't walk well anymore. She uses a walker. She can't drive. I do all her driving. My grandfather's on oxygen, and he uses a cane, and has had double hip replacement and a knee replacement and an elbow replacement in the last 10 years. So it's just very hard. Also, my eating has not been the best in the last week because I was stressed out. I didn't eat enough. My sugar has been dropping. Another problem since surgery is I have hypoglycemia, and it causes my blood sugar to randomly drop even after I eat. Sometimes even orange juice or regular sugar makes me have dumping syndrome, so it's hard to get my sugar levels back up. This past week I've been eating, and it's dropping low, between 50s and 60s even after I eat. Sometimes it won't come above 75. So I've been struggling with that, and I still can't eat large amounts. But my dietitian did put me on full fat stuff. Most people are trying to stay fat free after bariatric surgery. Mine put me on full fat because I just wasn't getting enough calories, even though I eat they tell me to eat 4 to 6 meals a day, small tiny meals, because I can only still eat about 3 ounces. My protein levels are suffering. My vitamin and mineral levels are horrible. So listen, guys, if your doctor puts you on vitamins and minerals and supplements, take them. Make sure you take them as your doctor tells you. You don't want to have to suffer with iron infusions and B12 injections, and it is not fun. And I struggle with that daily because, you know, it's a lifetime struggle after surgery to make sure you're getting in all your recommended amounts. And I know I look like crap today. Whew, no makeup. I feel like crap. I've been sleeping all day because, you know, I'm exhausted from last week, and my stomach has just been killing me. But I got my nails done. Woo. I took all my piercings out. It's so sad because of my gallbladder surgery. They took them out, and I just decided to keep them out for a while. Yeah, my hair has been falling out again lately. They say it's the worst from 3 to 6 months, and then it gets better for a little bit, and 8 to 12 months it can fall out again, and I'm struggling with that. And luckily I do wear wigs a lot. I have about 15 of them, so in all different colors. My boyfriend can pick if he wants a redhead or a blonde or a brunette or black hair. You know, it's fun. But thanks guys for watching, and you know how to contact me if you ever need to. Peace out.